uncover the surprising reasons behind unexpected weight gain and treatment in this video. From hidden culprits to lifestyle factors, we delve into the sciences of those extra pounds. Don't miss out on the insight that would get you treatment for weight management. The treatment of disease associated with weight gain typically involves a multifaceted approach that focuses on both managing the condition itself and addressing the underlying condition issues of the weight gain. Here is an overview of treatment for disease related to weight gain. Number 1 is type 2 diabetes. Treatment involves medications like oral medications or insulin injections, monitoring blood pressure, sugar levels, and adopting a healthy diet. Regular exercise and weight management to control blood sugar. And the secondly is cardiovascular diseases. Medication, lifestyle changes, healthy diet, and sometimes surgical interventions in service are used to manage heart conditions. Managing weight can significantly reduce cardiovascular risk factors. High cholesterol and triglycerides. Treatments includes medications like statins, dietary changes, exercises, and weight loss to control cholesterol and triglycerides. Number 3 is sleep apnea. Continued positive airway pressure therapy is a common treatment. Weight loss, avoiding alcohol and sedative positional therapy can also help manage sleep apnea. 4. Joint problem and osteoarthritis. Treatment involves pain management, medications, physical therapy, and lower back exercises, and weight loss to reduce strain on joints. Number 5. Cancer. Treatment varies based on type of stages of cancer, but may involve surgery, chemotherapy, radiation therapy, and targeted therapies. Weight management can help the risk of certain cancers and improve outcomes. Number 6 is reproductive issues. Weight loss, hormonal therapy, fertility treatment, and managing underlying conditions can help addressing reproductive issues related to weight gain. Next is physiological disorders. Therapy, counseling, support groups, and sometimes medications are used to manage mental health conditions associated with weight gain. In many cases, managing weight through lifestyle changes such as adopting a balanced diet, regular exercise, and seeking professional guidance from healthcare providers, nutritionists, therapists is a key component of our treatment. Weight management not only helps in controlling these conditions but also significantly reduces the risk of their development. Tailored approaches based on individual health needs are essential for effective treatment and preventions.